So we're going to look at a basic general massage of the quadriceps. First thing that we're going to do is get the towel in place just to make sure that we've got access to all of the soft tissue that we need. So we're going to bring the towel around the side of the greater trochanter. We're going to tuck in just there and then hitch. Ideally we've got the ASIS somewhere close to visible, greater trochanter there, and then we can drape the towel down just between the legs so that everything that needs to be covered is covered. So let's get some wax on the hands. Always wax the fingers, not wax straight to skin. We're not putting sun cream on. And let's introduce the patient to our touch. Let's spread some wax and also begin to palpate and feel the response of the tissues. We can feel for areas of tightness. We'll keep broad palms, quite superficial, quite fast moving. As we start to go deeper, we'll go slower and use smaller body parts. Always like to bring in some variation with the strokes. So we can go slightly slower and then slightly quicker. The one thing that we want to avoid is doing the same thing over and over and over again, because that gets irritating. Try and make sure that you finish off the stroke. You come around to the top, away from the groin, we come around to the hip. Keep contact on the way back, but the bulk of the pressure is going to be up in the direction of the heart. And we're trying to visualize the muscles that we've got here. So we've got the quadriceps, 4 quads. Really, we've got 3 palpable. We've got the medialis, vastus medialis, rectus femoris, vastus lateralis. So as we work through the tissues, we're trying to distinguish one from the other. And in that palpatory feel, it's going to be an effective massage for the tissues anyway. Start to go a bit deeper now. You'll see me slow down. So I'm reinforcing the thumb, beginning at the quadricep tendon, making sure that I keep good alignment of wrists, elbows, and shoulders. Keeping the thumb relaxed, pushing the pressure through from the fingers above. And when I get to the rectus femoris tendon, up to ASIS, that's when we release some of the pressure and come back. And we're going to repeat just slightly lateral to that stroke. Now focusing on vastus lateralis. And as we go all the way lateral, we might change hands. This is going to make it easier for you, but just be aware that as you come up near to the groin, those fingers are going to be in a precarious place. So just make sure they're coming off around to the side. And the medial aspect, we can do the same with this thumb. Reinforced, join sartorius, follow it up to the ASIS, and then come back. That can be quite painful, quite irritating. Sometimes we can get some tension build up and the person starts to hold themselves in a bit of a contraction. If that's the case, a light limb rock, and then some superficial effleurage once more. So we've got Petrissage as well. Petrissage just means that we're strumming across the fibers. A few different ways that we can do that. We're going to put the focus on the thumbs to start with. So we're squeezing, lifting up, and then catching it with the other hand. And we're focusing on the thumbs, so that's on the lateral aspect of the leg. We've got vastus lateralis and the IT band there as well. You'll see that I'm still moving up in the direction of the heart. And then we come back down and start the stroke again. This time, focus is on the fingers, keeping them flat, not pointy. And we can bring some adductors into it there as well, just making sure that we don't go any further up than where the towel is marked. Because that's a bit more superficial, let's go into something a bit deeper here now. So I'm going to go for knuckles. I'm going to place the hand onto the quad, straight wrist, elbow and shoulder, and this thumb goes into that crease. We call this a Canon spindle, and we can just lean the body weight down on top and slowly start to move through. Don't rush this one, and if you sense some tension building up within the patient, you may have gone a bit too far too soon. You can always ask for their feedback. Keep contact on the way back. As we go into the lateral side, swap hands. Be aware of what's happening with those right fingers. Make sure they stay on the right side of the towel and come back. So the final deep stroke that we're going to look at here is with the elbow. So it's not the olecranon process of the elbow, pointy bit, it's the shaft of the ulna just there. So make sure you're nice and relaxed through the hand and wrists. We're leaning the body weight down on top, working with gravity, so try to avoid coming in from the sides. A lot easier to put pressure down into the muscle here. So not a lot of force is required. And if you do need to get more specific with the touch, just bend the elbow slightly. Just be aware that that will mean it's easier to fall off one side or the other. We can go a bit faster as well, but just make sure you're more superficial, not quite as deep. So what else can we do in this position then? Well, we'd cycle those techniques in and out as we need to, trying to favour the deeper techniques, but obviously bringing the superficial ones in as and when we need to give some respite for the client. We can do an adductor focus here as well. So we're going to look at some pull-throughs, which is again Petrissage. But we're going to put the focus on this left hand here now. So fingers flat, and we're pulling through. You can differentiate the different tendons. We've got the adductors, gracilis, adductor magnus, and then sartorius. You'll feel yourself bump over that right before we get back into rectus femoris, into the quadriceps. We can do some Petrissage kind of movement there as well, with the thumb pushing down into the bulk of the adductors. But this is a quadriceps focused video, and if we were going to get into the adductors, we'd go into sideline position, which you'll be able to find on my channel elsewhere. Okay, last position then that we can look at for quadriceps is going to be to remove the bolster. So lift your knees up for me, please. Good, and legs back down. So bolster just underneath this leg, and we're going to bring this leg into it here. So we can either go left leg, which is more of a Petrissage kind of feel, or if we were to go right leg, that puts us in a position where we can bring the knee out, bring the hip into slight lateral rotation. It does open up the adductors a bit more for us as well as sartorius, but we can then start to lean our body weight down into rectus femoris and just go a bit deeper. Just be aware that the knee is slightly flexed, so it's going to be a bit more tension, particularly in rectus femoris, than there would be otherwise. Okay, this knee up. In the supine position, we can also put a good stretch onto the quadriceps by bringing the knee into flexion, leg off the side of the couch. So supporting the back of the knee, lowering the leg down slowly, making sure that the towel's in place, covering everything that it needs to. There we've got the knee in flexion. So it's going to give us a bit of a stretch on the quadriceps. So any stroke that we put in there into the quadriceps is going to be more effective, although we might feel some more tension kicking us out because of the stretch position. The good thing about this position is that we can use our leg here to bring that knee into further flexion. So then we can bring in like a pin and stretch kind of technique, using knuckles, slowly bringing that knee into further flexion as we go, releasing as we come back, and then repeating. We've got the standard effleurage with palms. We can also use a relaxed elbow there as well. Play around with your leg position and try increasing the knee flexion there to see how much of a change that we can get in those tissues. Always make sure when returning that leg back to the starting position, we support the back of the knee. So that's a basic massage tutorial for the quadriceps.